As we've seen over the last 6 months, rapid diagnostic testing is an essential tool in the management of pandemics, whether it's COVID-19 or Ebola. To discuss the ways laboratories can prepare for this and provide the best possible services, I'm joined by Matthew Binnicker. Matthew, thanks so much for joining us today. First things first, how would you describe the initial response to the COVID-19 pandemic? Were labs prepared, and how did this evolve over time?
Yeah, thanks for having me. It's a great question. So responding to the testing demand for COVID-19 has definitely been something that clinical laboratories have never faced before. It's been a significant challenge, and it's taken months to get to the point where most laboratories can meet that demand. During the really early phases of the pandemic, testing was mainly limited to public health labs and a select few large reference laboratories. And then as more commercial tests became developed and approved and available, then testing at smaller community-based hospitals became an option. And from this experience, we've really learned that there's a need to more rapidly distribute testing to as many labs as possible so that we can detect cases early in the pandemic and prevent an infection from gaining a stronghold in our communities.
Would you say that the method of smaller batch testing is the biggest lesson that was learned from the COVID-19 pandemic?
For me, the biggest lesson learned has been that we need to take this opportunity and the experience that we've gained during the COVID-19 pandemic to prepare ourselves for the next pandemic. It's really not a matter of if another pandemic will occur, it's a matter of when. So we need to build a strong coalition between public health and clinical laboratories, test manufacturers, the healthcare industry, and state and federal governments to build an adaptable framework for quickly responding to an emerging global health threat.
So you will be running a session on pandemic preparedness. Why should people attend?
Well, one of the things that COVID-19 has highlighted is that a global pandemic affects all of us. So we should all be interested, and we should all be involved in creating solutions for more rapidly and effectively responding to a global health threat like COVID-19. And during this session, we'll be bringing together experts from public health, clinical laboratories to share how these groups responded to the COVID-19 pandemic, what challenges they faced, what they had to overcome, and then how can we learn from the current pandemic to build a framework, a national system that will allow us to rapidly develop and broadly distribute testing to as many labs as possible during the very early stages of an outbreak.
And how would you kind of narrow down the top 3 issues that will be highlighted during the session?
So the first topic that will be highlighted is the significant amount of effort that our public health infrastructure takes on to monitor for emerging infectious diseases and respond to testing needs. And I really hope that participants in this session will gain a better appreciation for how critical our public health agencies are in preparing for and responding to these emerging health threats. Second, we'll review some of the challenges that both public health labs and clinical labs have faced during the COVID-19 pandemic and how they've worked to overcome those barriers. And then finally, in this session, we're going to focus on how we move forward. How do we prepare ourselves for future outbreaks or pandemics? So what are the lessons learned, and how do we use those lessons to build a system that makes us better prepared in the future?
And you briefly mentioned a moment ago that the session will include experts from public health, a community-based clinical laboratory, as well as a large reference lab. Why are all 3 of these different perspectives critical to this discussion?
Yeah, I like to think of public health labs, large reference labs, and our community-based hospital laboratories as the 3 points of a triangle. And each group is essential in responding to public health threats. Our public health agencies and large reference labs may serve as the foundation of that response, but providing early resources to our community-based hospitals, they're really the tip of the spear and are desperately needed during the very early stages of a pandemic to effectively bring it to an end. So we're going to have representatives from each of those groups at the table to help share ideas, options, and help to develop a sustainable solution in the future.
Matthew Binnicker discussing pandemic preparedness. It is certainly a topic that is the top of everyone's minds right now. Matthew, thank you for your time today.
Thank you. Glad to be here.